According to the Cancer Council of Australia, melanoma is the deadliest of three types of skin cancers. With other types of skin cancers, you might notice a sore that is getting a bit crusty and not healing very quickly or at all. You may even notice a small lump that is red, pale, or pearly in color. But with melanoma, it is more discreet and elusive because most of the time there are no symptoms, or the changes to an existing mole is so gradual over a period of weeks or months that you barely notice it. That's what makes it so dangerous. Sometimes you'll notice a change in color, size, shape, or elevation. Sometimes it might be a bit itchy or even start bleeding. Sometimes you might notice a dark area under your nails. What's even more scary is that Cancer Research UK explains that melanoma can spread almost anywhere in the body. Some of the most common places include the lymph nodes, lungs, liver, bones, brains, and stomach. GP can examine you with the dermoscope, which is a special handheld magnifying instrument, and look closely for changes to your spots. They will follow the ABCDE criteria to assess whether you have melanoma or not. Your GP may also feel your lymph nodes to see if they are enlarged. This may be a sign that melanoma has spread to the other parts of your body via the lymph vessels. If your GP thinks a spot or lymph node is suspect, the next step is a biopsy to take a sample and examine it under a microscope. To diagnose with melanoma, you may need to do some more tests like X-rays, CT scans, or MRIs to figure out what stage of the disease you're at and then what the best course of action is. According to Cancer Australia, melanoma goes through 5 stages. The earlier you're diagnosed, the less the melanoma has a chance to develop and spread. In stages 0 to 2, melanoma has not spread to other parts of the body yet, but in stages 3, it has started to spread to nearby areas, and in stage 4, it has spread to the distant parts of the body, and this is known as metastatic melanoma. Melanoma is a type of skin cancer that starts in the skin cells found in the upper layer of skin called melanocytes. They are activated by overexposure to UV radiation from the sun and produce melanin, which gives skin its color, and it is the third most common type of cancer diagnosed in Australia. Did you know, according to Cancer Australia, that 1 in 17 people will be diagnosed with melanoma by the age of 85? In addition to the risk factors, there are also a lot of predisposing factors that make you more likely to get melanoma, such as having fair skin, fair or red hair, and light-colored eyes, having a history of sunburns, particularly when you were a child, or having had a previous melanoma or skin cancer.
Preventative measures we can use to help combat developing melanoma later in life all involve protecting oneself from an overexposure of UV light. Since melanoma is caused by acquired gene mutations, which disable the tumour suppressors in our DNA, the only way of preventing skin cancers such as melanoma is to avoid this UV light, which typically comes from sunlight. Some preventative measures include sunscreen when going out in the sun and staying in the shade as much as possible. Sunscreen will filter out most UV radiation, however not all is filtered out and it only lasts for a limited amount of time, which is why minimum sun exposure is necessary, especially in Australia, where a hole in the ozone layer increases the levels of UV radiation, making skin cancer much more dangerous to the Australian population. Treatment recommendations for melanoma depend on many factors, including the thickness of the primary melanoma, whether the cancer is spread, and the stage of the melanoma. Surgery is the main treatment for people with local melanoma and most people with regional melanoma, as the first step in any treatments for melanoma before radiation therapy is brought in. Surgery involves the removal of the tumour and some surrounding healthy tissue during an operation and is usually performed by a surgical oncologist. Radiation therapy is the use of high-energy X-rays or other particles to destroy cancer cells using an external machine. Sometimes radiation therapy is recommended after surgery to prevent the cancer coming back, called a recurrence. After these two options, systemic therapy via medication induced to the bloodstream is also used to destroy cancer cells and help the patient.